What is anxious depression? Anxiety and depression are usually thought of as separate disorders, but sometimes they overlap and show up together. When that happens, we often call it anxious depression. Understanding this overlap is important because it looks and feels different from either disorder alone, and it often requires a different approach to manage. When anxiety leads to depression, anxiety can be overwhelming on its own. Constant worrying, racing thoughts, and physical symptoms like stomach upset, chest tightness, or even a throat that feels like it's closing. For some people, this state lasts for weeks or months. Living under constant tension can wear a person down. Over time, the ongoing strain of anxiety may drain energy, hope, and motivation, eventually leading to depression. In this case, you end up dealing with both conditions: the original anxiety disorder and the depression that followed. When depression comes first. On the other side, the main problem may start as depression. This can mean feeling hopeless, lacking joy, and having little to no energy for everyday tasks. Instead of constant worry, you may carry a constant sadness or heaviness. Tears feel close to the surface all day. Crying doesn't bring relief, it's layered on top of pain, and even after crying, the sadness remains. Sometimes symptoms of anxiety begin to mix in with depression, changing how the depression looks and feels. Depression with anxious distress. When anxiety blends with depression, professionals often use the term depression with anxious distress. This doesn't mean you have a separate anxiety disorder. Instead, it means your depression has a noticeable anxious flavor. The DSM-5, a guide used to classify mental health conditions, describes anxious distress as the presence of at least two of these symptoms most days: feeling keyed up or tense, feeling unusually restless, difficulty concentrating because of worry, fear that something awful may happen, feeling like you may lose control of yourself. The severity increases depending on how many symptoms are present. Mild, 2 symptoms. Moderate, 3 symptoms. Moderate to severe, 4 to 5 symptoms. Severe with agitation, 4 to 5 symptoms plus physical restlessness, like pacing or leg shaking. What does losing control really mean? People with anxious depression often worry about losing control. This doesn't usually mean extreme movie-like behavior. It's more subtle, like being unable to stop yourself from making a risky decision or reacting in a way you later regret. The fear of losing control is itself part of the anxiety, often exaggerating what might actually happen. Physical signs of agitation. Along with emotional symptoms, anxious depression often shows up in the body. Motor agitation is the term for this. It refers to restless physical movements. Examples include pacing around without reason, shaking your leg constantly, clicking a pen repeatedly, clearing your throat over and over. These small actions may not seem like much, but they can reflect the inner tension of anxious distress. Why anxious depression is different. Studies show that anxious depression is not just an emotional state. It's linked to measurable differences in the brain and body. Brain scans have shown thinning of gray matter in certain areas. Gray matter represents tightly packed nerve cells that handle thinking, emotion, and self-control. People with anxious depression may also show different stress responses in blood work compared to those with depression alone. This suggests that anxious depression may be its own distinct form of depression, not just a random mix of symptoms. The challenge of treatment resistance. One of the hardest parts about anxious depression is that it can be tougher to manage than depression alone. Many people find that standard approaches don't bring enough relief, or they only help partly. This is sometimes described as treatment-resistant depression. Struggling to improve despite effort can feel discouraging, but it doesn't mean recovery is impossible. It just means the path may take more persistence and different strategies. A broader approach to healing. While no single solution works for everyone, people with anxious depression often benefit from a combination of approaches. O-therapy, especially approaches that target both thought patterns and coping skills. O-stress management, daily practices like meditation, deep breathing, journaling, or gentle exercise. O-lifestyle changes, improving sleep, nutrition, and routine helps stabilize mood. O-social support, staying connected to friends, family, or support groups helps reduce isolation. The key is flexibility. trying different tools and giving yourself time to see what combination works best. So, anxious depression is not just depression, and it's not just anxiety. It's a specific and often tougher blend of the two. It can show up when anxiety leads into depression, when depression picks up anxious symptoms, or when both arrive together. It feels different, looks different, and often requires a broader, more patient approach to improve. If you find yourself experiencing both anxiety and depression together, know that you are not alone. Many people face this struggle, and with persistence, recovery is possible.